As we know, telehealth and virtual care is way more than direct video conferencing with patients. There's all types of things that can be wrapped around the service that can help you manage your patients remotely and get more touch points with them. On today's episode of Sam Talks Telehealth, I'm talking with Matt McBride, CEO and co-founder of Mend. Let's get into the podcast. All right, Matt, I'm so excited to have you on Sam Talks Telehealth. Welcome to the show.
Yeah, thank you. Thanks for having me. Excited to be here.
Yeah, so we've been in touch through the internet for a couple of years, keeping track of each other. I want to just start off with give us a little bit of an intro about yourself and about Mend so that the audience knows who you are.
Yeah, so I'm Matt McBride, CEO and co-founder of Mend. Mend is a complete patient engagement platform. We've been around since 2014. We have about 4 million patients on the platform. We're known for telehealth, but we also do other things like digital forms and payments, appointment reminders, scheduling, patient self-scheduling. So we have really a complete patient engagement platform that can meet the needs of the new sort of hybrid care of this in-person care and now this virtual care that we're all delivering as well.
I love it. And I think we're both starting to really see that rise of that word, the hybrid care. So more we can do with that, the better. Well, you've been in this space since 2014, and obviously COVID is an immediate what's changed since then. But aside from COVID, what's some of the biggest changes you've seen in the virtual care space?
Yeah, I think really a lot has changed, and it's kind of amazing to see. I mean, it's a pandemic. I mean, if you look at how much just the world has changed from this event, it's incredible how something can just affect the entire planet. We can see these shifts into virtual care. I would say that more not a lot has sort of changed for us. I think we were always focused on how do we deliver care to the patient where they are in their home. And this was difficult to do before the pandemic. I don't think a lot of people realize that it was difficult to do. A lot of the reimbursement models were still based on the patient coming into a location and the provider could be remote. And so I think a lot of folks are catching up with, well, if I am now seeing the patient in the home and they're not coming in, what about all these other workflows that we have? There's still paperwork. We have consents. We need to get all their insurance information, driver's license, any payment information, credit cards. We still need to do all those things. Maybe we want to have a check-in process. They see the nurse, the doctor, and they go to checkout. So I think just seeing more of groups, seeing, okay, how do we take our processes that we do in person and how do we move those to the patient's home, and how do we have all the tools that we need so those don't become a lot of manual tasks that are really burdensome, having to exchange PDFs back and forth or make phone calls or whatnot. So I think we were always focused on that model of that in-home care and still helping groups with the in-person care, and I think we're just seeing a lot more of that, and I think more and more it's going to become the norm for us here moving forward.
Yeah, and I think that's important because that idea of, I think it goes, people didn't realize how much goes into doing virtual care. And so pre-pandemic, yeah, we might have a workaround, or we might be like, oh, I don't know if that's that important. But now when you really have a true hybrid model plus virtual first kinds of models, I think we are seeing more and more, even critical access hospitals or small community rural health centers saying, wow, I need a way to get these forms. My EMR doesn't do it, or it'll cost me so much money to have that done. And of course, they like the features of the virtual care and remote, but if they can't get all the information they need, then that's a huge issue. So I hear that from clients on a regular basis also, like, hey, I've dialed in my telehealth service, whether that's video, phone combo, but I'm missing, these other workflow kinds of pieces. So I think you're right. And I think it's also that idea of because we're working so differently, wasn't just the volume of the pandemic, but now we know it's here to stay in terms of this virtual remote interactions. And so now people are saying, oh, well, I better actually have all the right tools, or, it's going to be piecemeal. Like, how many times do people make the jokes with you, in EMRs about the, what do we always say, the image tab, right? That like other tab that has like every single PDF in the planet in there.
Yeah. And there's a lot of sensitive information in there. You can't just open up the EHR for patients to just go in and do whatever you want. And yeah, it is a lot more than when we go to the doctor's office, we don't just go boom right in and we're face to face with the doctor. And that's really that video component. It's all the other workflows that are happening that we have to think about now, and then make it super easy, right? You can't be downloading software, can't be logging into patient portals. It has to be super easy so that we can get everything and that it works for everybody that the practices are trying to help.
Absolutely. For a short break in the podcast, I want to talk to clinicians out there who'd like more resources and support around getting on the camera. We know you've been doing it for well over a year, but there's still some things that can always help you present just as professional as in clinic as you do on camera. So for additional resources, I've created a workshop called Camera Confidence for Clinicians. You can find that at telehealtheasy.com/camera. And that's a workshop to really help you get more connected with your patients, feel as professional in person as you do on the screen. And it's a nice workshop to be able to give you all the tools, checklists, and some really easy hacks to make it, less overwhelming to be on camera and not so worried about, the second chin or any other variety of things. But we've got you covered. telehealtheasy.com/camera for a great workshop on improving your virtual health visits. And with that, let's get back to the podcast. And that goes perfect into my second question, which Mend is more than a telehealth platform. You've got things like digital forms, appointment reminders, all different kinds of things. What do you think is like a sleeper feature for Mend that maybe at first the practices say, I don't really need this, but once they start using it, they realize the value of it?
Yeah, I think our digital forms definitely, and we typically end up packaging that up with telehealth because it's so versatile. Whether you want to do, we do agreements. If you need to have multiple parties sign, behavioral health with treatment plans, you have to have the patient sign, a provider sign, and we can do that. You might have clinical assessments that provide important information on assessing that person's health in different scenarios. It might be billable. You can have any intake form, can take pictures, you can collect payment, get their pharmacy. I mean, it can really collect any information you want. So I think when people see that, and then we make it very easy to access those forms. So for example, patient will get a link and text and email, they click it, date of birth, and that's it. So we'll see about 60% of those forms come back within an hour. And we're actually thinking about that as the new appointment confirmation, right? Because if you do your paperwork too, that person's coming into their visit, they're engaging in that encounter that's going to happen. And so I think that one definitely. Some of the other ones that are probably more telehealth related, I would say are just for the ability to nudge the patient. So one of the things that we talk about and that I think our more successful groups do is they always connect into the visit. That sends an automatic nudge via text and email to the patient. And you can also send other nudges. So I think, joining the visits, nudging, that's a good one. Picture in picture, I think is huge for providers, so they can be in a chart but still see the patient. We also have phone call reminders for telehealth visits. So phone calls with the right population can, take a no-show rate from 50% to, something in the single digits. And then finally, we have a dialer as well to call the patient and a backup, bring in a translator, bring in a spouse, a parent, or anybody else that you need to connect into a visit. So I think that's one that a lot of people don't think about, that, oh, we can make a phone call and bring that person in.
So I love this. Let's talk a little, like 60% return rate on patient intake forms within an hour. I mean, that's insane, right? So I can think about if someone, they send me, hey, go to our website and fill this out. And like, I'm the worst patient. And so maybe I do it an hour before, but that hasn't really helped them. I also think about the arduous process of logging into a portal to fill out these things. So, I mean, that kind of rate is incredible because, again, it's more forward information for that clinician to already have it in there. So, I mean, kudos to you on that 60% rate. Now, the nudges, I also love these nudges, right? Because so you're saying when a provider, when someone logs onto the system, if the patient's not there yet, it's sending them out a nudge like, we're ready.
Yeah, and it just goes out automatically via text and email. It'll send both if we're provided with both. And I think those things, they definitely add up. I think that we are already sending text, email. We can do phone call reminders as well. So it's not like, the no-show rates when you move to telehealth are going to be much better. And I think ultimately that's the main reason why people usually look to telehealth before the pandemic. During the pandemic, now nobody wanted to come in. It's all, that's sort of the main problem that I think you see when groups are looking to implement telehealth. So it's, telehealth, the no-show rates are going to be low, but I would say the groups that have phenomenal, productivity rates, they are doing those things. They are nudging. And if you can, move the needle 1 or 2%, that can be significant. You're helping a lot more people, and that can really be significant to a group to do it. And it's built in, it's automatic.
Yeah. And I think like you said, even the nudges for phone calls is the reality is we can be getting busy. We can just be sidetracked. And if we don't have a timer, on our phone that told us, we can just accidentally miss it. And those nudges, I think that's just perfect. It's so interesting because in that face-to-face world, yeah, I mean, it's normally a 24-hour confirmation automated. It's not like a half hour, an hour. So when you come in this virtual realm, you're increasing those touch points, even with the nudges. Hey, we're going to start in an hour. Hey, someone's already there waiting for you. And what we know also about the no-show rates, not only helping more people, but because providers are so overstressed with time, every lost person makes it very difficult then to recoup that time. So absolutely, I love that. And I love for the phone calls too. I think, again, people kind of take for granted, oh, they'll remember my phone call or they'll do it, and they don't. And so a nudge is I think it's a nice way. And I think in healthcare, we've been reticent to do that, or we haven't had the tools to do it. And now with how tech is, we certainly can. I love it.
There is one other, I think, really cool thing that we have, that we have created. Wait times can still happen on a telehealth visit, right? And so we've created this Netflix style waiting experience with educational content. So if a group wants to have education about their organization, or they just want to have some of our educational content, what's interesting about that is we've seen patient satisfaction go up 23% if you improve that wait room experience. So across all of Mend, we're seeing an average rating of about 4.7 out of 5 with those types of experiences. So I think that's another sort of sleeper feature that once groups see the data, that you can't just be staring at please, somebody will be with you in a minute screen. So
yeah, because that someone was with you in a minute, 10 seconds feels like 5 minutes. So I love that too. Okay, my final question, I always like to know, if you could change one thing in healthcare, what would it be?
Yeah, I think seeing healthcare shift to how do we make people healthy? How do we how and I we're starting to see this with value-based care, and I'm starting to see it with folks that I know as well that are, being rewarded if they, hit 10,000 steps 10 times in a month, or do these things. I think really a lot of healthcare is, when a problem happens, how do we become more proactive and sort of prevent these things? And I kind of hope that the digital is a way to do that. If you can make it easy, maybe people would be more willing to engage in their health. And I think the government is moving towards, and the industry is moving towards, new reimbursement models through value-based care to reward organizations. But I think ultimately that's what we've got to do, is how do we just, keep people healthy to begin with.
Well said. Well said. Amen to that. Well, Matt, I want to thank you so much for coming on the show today. Love to have different perspectives and all the work you're doing at Mend. It's very, very appreciated.
Yeah, thanks for having me, Sam.
And I hope you've enjoyed today's episode of Sam Talks Telehealth as much as I have. Don't forget to subscribe and like the podcast. That way you know when the new ones are dropped. And for all of those who want to learn more about telehealth, more resources, and have a chance to work with me directly, feel free to go to telehealtheasy.com, where you can find all the online courses and specialized services that I offer. We'll see you back here next time.